Hey guys, I'm Tara. Welcome back to my channel. Today we're going to answer the question, is pain with sex normal? So we can pretty much just answer this question right off the bat, and then we'll get into more details on what could be happening. But no, not in any gender, pain with sex is not normal, and you do not have to live with it. I know from working in the pelvic health community that a lot of women unfortunately do think that pain with sex is just normal and is just something they have to live with. I don't know if men feel like this so much. I feel like men more know it's a problem, but they avoid getting help for it. So either way, it's not normal and there is help out there for you. And today I'm going to talk to you about kind of what can be happening and be causing this pain. So before we get any further in this video, just know that pain with sex could be from things like an infection for men or women, and for women it could be things like maybe a cyst. So it is important to see your doctor and make sure nothing serious is going on that would require medical attention. So assuming you've been to the doctor and nothing is going on medically that needs to be addressed, a very likely culprit of why you're experiencing pain during sex is tightness in the pelvic floor muscles. So I've talked about this before. I've done videos that go over the pelvic floor, so I'm gonna link those in the description down below so that I'm not really repeating myself here. But basically your pelvic floor muscles, so in women, these pelvic floor muscles need to be able to relax to allow for penetration when you're having sex. If these muscles are in a tightened state, it's gonna be painful to try to have penetrative sex. The way I kind of describe it for women is just imagine that you did like a maximal Kegel, like you really tried to tighten those pelvic floor muscles. It would probably be difficult to have sex like that. So if your muscles are, obviously they're probably not in a super contracted state like if you did a maximal Kegel, but if they are in this more contracted state, it is going to be difficult to have sex and it could cause pain. The medical term for pain with sex is dyspareunia, so if you've ever heard that, that's what that means. Dyspareunia doesn't really give you a specific diagnosis on why you're having pain with sex. So in women, it could be vaginismus, it could be vulvodynia, it could be just general pelvic floor dysfunction. Sometimes even the diagnosis, we get so caught up in getting a diagnosis, but for a lot of these pelvic conditions, the treatment is pretty similar. In men, so I do like to share a little bit about men too, because a lot of times people think women are the only ones dealing with pelvic floor issues, but men can be dealing with this as well. So if a man is experiencing pain during sex, assuming nothing medical is going on, it's usually also from tight muscles. It's just a little bit different than with women. So for men to have an erection, the pelvic floor muscles kind of have to contract. So it's more of a pumping action. And if the muscles are in a tightened state already, then sometimes that contraction can be painful or cause pain. So why does this happen? So your pelvic floor muscles, so it is like a group of muscles like anywhere else in the body, but they are a little more complicated in the way that, one, they're playing a role in sexual activity, two, they're also playing a role in your bladder function, and three, they're also playing a role in your bowel function. So really something going on in any of these areas could cause these muscles to get tight. For women, things like endometriosis, interstitial cystitis are also common things that could be going on that might lead to pelvic floor tightness that could cause pain during sex. It's also important to know that the pelvic floor muscles and the hip muscles are really closely related. So something going on in your hip joint could possibly lead to issues in the pelvic floor. So if you hurt your hip a while ago and it was never addressed properly, maybe over time this could lead to tightness in the pelvic floor muscles. These are just some things that can cause pelvic floor tightness, just to give you an idea. It could really be a broad range of things, but just so you guys have a little better understanding of this area. When it comes to the pelvic muscles, it's also not always a physical issue that is causing these muscles to be tight. Some people just hold their tension in the pelvic floor. I've probably talked about this on here before, but the way I describe it is some people will hold tension in their neck when they're stressed out, right? So I don't know if you're someone that holds tension in your neck. I do. So your shoulders might be up and elevated, and when you're really stressed out, you feel that tightness in your upper traps. Some people hold their stress in the pelvic floor. So they hold the pelvic floor muscles in a state of tension. over time, this could lead to things like pain during sex or tightness in the muscles. Another thing when it comes to sex is that it's just a more emotional thing than, say, when you hurt your shoulder and it hurts to reach overhead. And even if you don't think sex is emotional, our energy, so like the energy in our body, so I know I'm getting a little yogi here for a second, but I'm both a yoga teacher and a physical therapist. So our energy, so where our emotions are stored, is in our sacral region. So it's literally in the pelvic region. So it's an emotional area. It can bring up emotions. You can store emotions there. So it's really just more complex than some other body parts. It doesn't mean that you can't improve or that it's never going to go away. It's just kind of a different way to look at it. It could also, I know for people, it could also feel really isolating. Some people don't want to talk about it. They feel embarrassed about it. It can cause stress in a relationship. So there's a lot of things that can go on when you are having pain with sex, and sex should be an enjoyable part of your life. So when this is all happening, it really can be a stressful thing that you're dealing with. But like I said, there is help out there for you, and it shouldn't be something that you feel embarrassed to talk about. A lot of people do struggle with this, and there are professionals out there that can help you. From my practice, I have seen women, and it's been a few, it's not like it was just one woman, but that was in their 50s and started to develop pelvic issues after going through menopause. So that's how they ended up coming in and seeing me. And then the woman would tell me that she has had pain with sex her entire life and just thought it was normal. And I really don't want that to be the case for any of you. Sex should be something that you enjoy. It shouldn't be a painful, stressful part of your life. So I just want you to know that it's not normal and there's help out there. I know I'm kind of getting repetitive, but that's really the point I want to make. So I do suggest talking with your doctor for men, maybe your primary care for women, talking with your gynecologist about this. If they're not giving you guidance on where you should go from there, and they do testing and there's nothing going on medically, and they're not offering you something else, I would highly recommend seeing a pelvic floor physical therapist. So there are physical therapists out there who specialize in treating pelvic floor issues. Pain with sex is a common thing that these types of physical therapists see, and they can really help you. So they can assess what's going on, and they would be able to tell you if it is the muscles that are causing your issue. So I really highly recommend that you do see a pelvic floor physical therapist, and I think that's a really good place to start in order to start your healing journey and to be able to heal from this pain and be able to have sex pain-free and have it be a part of your life that you enjoy. So I definitely could talk more about this. I could talk more about how pelvic pain during sex relates emotionally into our energy and things like that. So maybe I'll make a follow-up video on that. I don't want to make this video too long today, but conclusion of this video, pain with sex is not normal and there's help out there for you. So yeah, that's all for today's video. Thanks for watching. If you're not already subscribed to my channel, please hit that subscribe button right below me, and I'll see you guys in my next video. Bye guys.